They talk to me about all the things that happen.
It speaks to that, every area is different, and connecting to people is so important and reaching them where they're at.
I hope that people start stepping in and stepping with others to be able to bring care and hope to the communities that we serve. You're right there with them, and for those of us that would like to help, we don't know how to help, but you can tell us.
Welcome to the Roots of Wellbeing, where we explore the data, the stories, and introduce you to the people who are planting seeds of change across their communities. Once again, I'm your host, Stephen Cavazos, and for today's discussion, we're talking about connection, but specifically how Methodist Healthcare Ministries, Wesley nurses, and Promotores, our community health workers, draw on their experience of local neighborhoods and identify partners to find ways to better serve their communities. And before we really get into this subject, I want to start with some introductions here.
Lilian Chondo, promotora and community health worker.
Cynthia King, regional dental hygienist for regions 8 and 11. Sonia Cavazos, I'm Stephen's cousin. Same last name. I'm the Wesley nurse here at Coker Methodist Church.
Well, it's great to be joined by friends and family. Just kidding. But it is great to be joined by these voices of experience. And before we get into the discussion, we're talking about connection. What is something that you all hope to grow out of this conversation?
Well, I hope that people start stepping in and step in with others to be able to bring care and hope to the communities that we serve.
Mm-hmm. Beautiful.
And just the notion that just by striking up a conversation, which is what happened with us, and we'll talk about maybe later, that opportunities to collaborate and expand your function.
Absolutely.
Mm-hmm. And my hope is that in this dialogue helps people see the real impact of community health worker in this community.
Well, thank you so much for sharing those intentions with us. And we're really excited to have this conversation and bring this information to our audience. I want to open up with where we are at today. We are at Coker Methodist Church here in San Antonio. This is where we have our Wesley nurses. This is where we have our promotoras. Tell me a little bit, though, Sonia, about the work of a Wesley nurse. I mean, we're going on nearly 30 years of Methodist Healthcare Ministries Wesley Nurse Program.
So as a Wesley nurse, we are registered nurses, and they place us at a church site. And I'm here at Coker Methodist Church. And so we promote health and connect people with different resources. That is a huge thing that I do here at Coker. And we help coordinate different services like medical clinics, dental clinics, resources that people don't have, and they really appreciate the guidance that we give them to be able to do that. And it's really a ministry of caring for the whole person, body, mind, and soul.
And that's one of the things that I think is such a hallmark: the body, the mind, and the soul. That's so important to just take that into this conversation, and also into the work that you do every day. With each area across our organization, 74 counties, every area is different. Tell me a little bit more about the population and the demographic of the people that you guys serve here.
So we serve the uninsured, the underserved, and that is our target population. Many of these clients face barriers such as food insecurity, lack of insurance. And through this community partnerships, the nurses connect individuals and families with prevention health services that support the overall health and well-being of the person.
And that's very important.
Mm-hmm. And as a Wesley nurse, we are health educators. We promote health, and we are spiritual care providers. When the client asks for prayer, when they request it, we do that. We are health advocates, like I said earlier. That's a huge part for me. And we connect to different affordable care, such as I have mobile clinics here, community care, mobile unit that offers 11 free women's services free of charge. And they're here at Coker 2 to 3 times a month. And so that has been a huge resources for these people that can't get a pap smear. They don't have the money. And what's so good about this bus is that if they come to the bus, it's free of charge. But if they go to Communicare, the clinic, it's not. It's a sliding scale. So also, of course, work with Krista Santa Rosa Mobile Mammograms. And they visit here Coker every other month. And I also go to West Avenue Compassion. It's a church that I've been going to, a food pantry, for the last 11 years. So whatever resources I have at Coker, I take it to West Avenue Compassion. So the mobile mammogram is here, ensuring from January through December, a mammogram bus is available at these locations. They alternate sites, like we start January here, February they go to West Avenue. So there's always a scheduled resources for the patients, which is very good. And always try to do it on the day of the food distribution. A lot of these patients don't have transportation.
That's a big one.
That is a huge thing.
That's such a big thing.
And you capture these people once they're here because they need food. They will come for food, but if I schedule a resource on another day that's not Tuesday or Thursday, it's very difficult for them to come because of this lack of transportation. So there are other organizations that I collaborate with is YWCA. They promote health education, and University Health offers classes on health promotion and prevention of chronic diseases. Partner with UIW, University of Incarnate Word nursing students. They provide our vaccinations here at Coker and West Avenue. Texas A&M AgriLife, they do our nutrition classes, and also with the other program of Texas A&M, the Expanded Food and Nutrition Education Program. During spring break, we have free haircuts, and summertime, free haircuts
too.
Yes, for children and adults. And this is made possible through our food pantry clients. They volunteer their time.
Wow.
And of course, volunteer barbers. So during spring break, we had 70 haircuts that were provided for the food pantry clients. Texas Department of Health Services also partners with us to provide free dental care for the children for the last 10 years. I guess it's been like that, right? The San Antonio Metropolitan Health District provides education on diabetes. Organize quarterly blood drives here at Coker Methodist Church to support the community's ongoing need for blood donations. Also collaborate with West Avenue Compassion, like I said. They have a grant for diapers, so they have shared their diapers to give to me so I can share it with the Coker Food Pantry clients. Vouchers for free eye exams and glasses. Worked with the Lions Club, Coker Methodist Church has given it, and Methodist Healthcare Ministry as well. That has been a huge impact on my clients. A lot of these, they don't have eye insurance. They can't afford glasses, and eye exams are so expensive, very expensive. So they get really excited when they're able to receive these vouchers, and they come back and they show me their glasses, and they're so happy to be able to see. Some of these clients have gone, when a lot of immigrants that have come from their country and had to go through jungles, they lost their glasses. So for a long period of time, they can't see, and I can't imagine. I wear glasses, and I can't imagine not having my glasses. So that has been really a great resource.
There's so many things that are happening here at Coker. A lot of programs that the Wesley Wesley nurses are offering, but every area is unique. And it's interesting. We're going to talk a little bit more about how we are connecting those resources to our demographic and the communities that we serve. But for anyone that wants to learn also more about Wesley nurses, they can always head over to mhm.org and just search for Wesley nurses. I do want to talk to Lily a little bit about the work of a promotora, because you were also stationed here at Coker. Tell me a little bit about the work that you're also doing.
Well, my role here is connect the clients with a lot of resources that Sonia mentioned, and also be able to help with sometimes via passes for transportation, and give them a lot of resources also.
you're real good about going to the patient's home and delivering things that they
Yes.
need.
That's very
Either
important.
diapers or
delivering
food.
diapers, sometimes
Yes.
food.
You're going directly to the people.
Yes.
Going
so
to
important.
I share a lot of these services with my school family specialist. I going through the schools and share all these kind of services here, free services.
Absolutely. I mean, seeing you're going directly to the people that and bringing that information to them, and also I would imagine learning so much about the need, right?
Yes.
And you talk directly to them, in Spanish, which I think is also so important because it speaks to that, every area is different, and connecting to people is so important, and reaching them where they're at. And they may be people who do not speak English. So you're talking to them directly in Spanish, and that's something that I think is very unique about Promotoras.
Yes, they're very confident on me. They talk to me about all the things that happen on their families.
Wow.
Because they're afraid. Yeah.
And they find the trust, I imagine, also with the work that you guys are doing. I appreciate you sharing about that work, and we're going to go a little bit more into depth with the work that you're doing. But, I also want to talk to you, Cynthia, about your role as a regional dental hygienist. I mean, you serve a pretty large area. South Texas is no small area of Texas.
47 counties. But, before I go on, I wanted to both something Sonia said and then Lily, the fact a lot of us just don't even think about these things, about not being able to have glasses. I mean, the cost alone of lens. And I can think of probably 2 different pair where my prescription has changed, and I'm thinking, those are sitting in a drawer when I could be bringing them here and them reusing frames, with your vouchers. And then something you said, you're so important because you're right there with them. And for those of us that would like to help, we don't know how to help, but you can tell us how. And so that information, I think, is so important.
Love that.
But anyway, as a Region 11, we have 19 counties, and Region 8 is, I don't know, it adds up to 47 counties. But we do go into schools, and it's preventive services only. But we're, you think of the services that are available, Medicaid, CHIP. We're kind of that final safety net, I guess you would say, and we will see any child that returns a parental permission form that is completed and signed by their parent. But what we're striving for is that that child that their parent makes maybe just a little bit too much to qualify for Medicaid. We're trying to capture that child that really needs that resource. And this is an exception for us to be here in Bexar County because there's Metro has a sealant program that works within here, and we don't want to duplicate services. But it was such a great collaboration that we have permission to do that.
Right.
But so we seek to go into those counties, maybe where a dentist is an hour and a half, 2 hours away, and try to. We do stress that we don't take the place of their dentist. We try to enforce that they need a dental home, but we're just kind of that safety net.
Right.
So I feel really good about what our program does and in prevention.
And to just clarify, this is the Smiles in Schools
Smiles
program.
in Schools.
And this is a really important program, and I find it interesting also in terms of identifying, those students and trying to reach out to them. I would imagine this is also why partnerships with organizations, Wesley Nurses, Promotoras are so important.
Very, very important because, again, you have the ability to because of the trust that you have developed with them, then that they can be at ease knowing that what we're all about. And just to share that information is just invaluable, so that resources can reach who really needs it. So,
Absolutely. That's the importance of connection.
Exactly.
And that's why we're here.
We're trying to provide something that they need and not something that I think they need.
That's important why we collaborate, why we listen, why we learn.
when you find these collaborations, it helps extend what resources you have.
Very important that they know how they can get the information that they need.